everyone, I'm Shuichi Fukunaga, a Japanese orthodontic doctor running a private clinic in OMIYA, Saitama City, Saitama Prefecture. I specialize in occlusion, orthodontic, and oral and maxillofacial surgery. I have worked at the oral and maxillofacial surgery department of a major hospital in Saitama for more than 30 years. I headed the department before I started my private practice. It was during my stint at the hospital that I specialized in occlusion and orthodontics for 15 years. So let's understand what is occlusion or good teeth contact. In my studies and years of experience in this profession, teeth contact is considered good when the hinge
こういう
axis of jaw
ガ
joint
チャガチャ
doesn't
ガチャガチ
shift
ャや
or
るので、
shake when you chew or
こう
grind
い
your
う動き
teeth.
が、
The hinge axis is most critical part of teeth occlusion because it is the starting point of teeth contact and it determines where the lower jaw teeth exactly contact with the upper jaw teeth. Awareness of our teeth contact prevents tooth loss and TMJ disorder, and it is also related to other body problems like bad posture, stiff neck, headache, distortion of facial structure, and others. It's impactful on our daily life situation, so it has vital role. Therefore, there is necessity in getting familiar with our teeth contact because we chew when we are eating and grinding our teeth when sleeping. If your occlusion has a leverage and seesaw movement, this will gradually damage your teeth and jaw joint. As shown in the figure, the hinge axis of jaw joint determines where the lower jaw teeth exactly contact with the upper jaw teeth. Teeth contact occlusion always should not hinder the harmony with the hinge axis of jaw joint. To better